Every podcast starts with the back of my head. All right. Dr. Lindsay.
Hello.
Thanks for coming out.
Thank you for having me out here.
Yeah. Nice little backyard all the way out in the bush.
Yeah.
Nice relaxing area. So we're at 7 Evolution here. We're always looking to basically answer some questions, right?
Right.
And as we're going through a project here, we're always trying to figure out what we should do, what we shouldn't, what's best for the body. And I think a lot of people like me would start out with all these myths and questions and have no idea where to start and where to start getting the answers for. So I think we should start with if you have any advice for like someone like me, a person like me that started out mid-30s, shoulder injury, knee injury, back injury, wants to get back into shape, overweight, stuff like that. So I'm not alone out there. It's growing. So I figured it's always a good thing that we talk about it and see what we can get some more information out of it.
Absolutely.
So my first question for you basically is how would chiropractic really work into everything that we're trying to do here, and for advice for anybody going on?
Right. Well, you mentioned having an injury. So starting off an exercise program is fantastic. Starting an exercise program while you're injured and not rehabbing the injury, probably not a good idea. Okay. That's the best way to have a really short career in exercise.
Yeah,
so I always recommend people to first off get their body to be able to move better.
Yeah.
So get it assessed by someone. If that's a chiropractor, amazing. If it's a physio, a massage therapist, your MD, someone that can take a look at you to say, hey, here's something you could work on, or here's things you should avoid doing, or here, let's start somewhere. Yeah. So obviously I think chiropractic's pretty great, so let's start with chiropractic.
Yeah.
Most people think of chiropractors as being doctors for the spine, which we are. Absolutely, 100%. My specialty is the back, for sure. But I also work on everything that attaches to the spine. Shoulders, hips, knees, all that kind of stuff. So what we can do is assess those joints, see how they're moving, see if that, however long you've had that injury, if that's had an impact on how your spine moves. Because if your spine moves differently, everything attached to it's going to move differently too. So a left knee injury can cause a left hip injury or a shoulder injury, and they can all be related. So my job as a chiropractor, look at your spine, look at your joints, look at your muscles, figure out if there's something going on that we can help with, and then do some treatment for you if that's prescribed. Yeah. Or refer you to other professionals if it's not something I'm comfortable dealing with.
Sounds good.
Yeah.
Perfect. And I can attest to that because when I started going to see you, the very first golf game I played after that, my slice was gone.
Yes.
Because you told me that.
I will obviously take the credit.
Take it all, because I had a horrible time at it for the last 15 years. But you essentially told me that my pelvis was getting pulled up to one side.
Yeah.
And I don't even know what would have caused that. Probably a lot of impact from the very soft sports I like to play, like ATV, hockey, football, all that wonderful soft sports. So I'm guessing a little bit of that, but it was nice to get that fixed out and work from there.
I probably told you it was due to your posture as well.
Yeah, probably.
I use that word a lot.
Well, posture as well can, I still am, but I'm overweight. So how does that affect the posture?
Well, I mean, when you carry more weight on your frame, your body just has to do more work. Mm-hmm. So is it designed to do that? Perhaps. Can it handle it? Sure. However, most of us don't put weight on sort of totally evenly. A lot of people put a little bit more weight in their abdominal region, which means that your body has to then compensate. If you think about a pregnant woman, this is a great example. Someone, again, who's putting on more weight, generally more in their abdominal region. Their body changes, their back tends to arch a little bit more. Often at the end, there's some discomfort with pregnancy. But pregnancy is a finite thing. It ends. You have a baby, and there it goes. Yeah. And I would say maybe that's the difference with some people who carry more abdominal weight in general, is that there may not be an end to that. You're not going to have a baby and off it goes. Mm-hmm. So that just means a change in the posture. Usually low back, for sure. And then the rest of the spine as it has to compensate from there.
Okay. Yeah. As when you're like the overweight that I was, what do you suggest to start working out? Like in that area, because I know you never want to go heavy. I know that.
Walking,
moving.
Okay. Any kind of movement during the day.
Yeah.
Just to get more movement in general. So I even recommend don't sit for longer than 20 minutes at a time. That little bit of changing your posture, getting up, and moving more regularly, for some people is already a lot more than they normally do. Mm-hmm. That, number one, get started there. Just get started to move. Yeah. And then I would say if you're really interested in fitness and you don't know anything about fitness, consult with someone who knows. So a personal trainer is a great example. Okay. Someone who has some idea, or the internet is full of tons of advice, but go on a learn to run program if you want to start running. Mm-hmm. Don't just say, you know what, I heard running is great, today I'm going to run 5K. I've never run before, but I think I should start 5 or 10K. That sounds pretty easy.
I would say you'll find out very soon.
You'll find out in kilometer number 1.
Yeah.
But I would say that's something to start, a learn to run program.
Okay.
They have those things.
Yeah.
Or going to a gym and having a personal trainer assess your movements as well. They're looking at a slightly different perspective than a healthcare professional might, and be able to give you some advice on just simple things. But mostly it's simple stuff. Start moving more. Take the stairs instead of the elevator. Park a little bit further from your parking spot. Get some movement to start with, and then go from there.
Perfect. I hear, like, for me, the chiropractic part of it is covered by my insurance. That being said, because I know a lot of people might have the coverage but don't even know or don't realize or don't want to go for many different reasons. But how do you see it as how do you see it when it becomes as a whole for the health of a human, basically, like for what we want to do? We want to be healthy on all levels if we can. How do you encompass that in the circle of health, if you will?
Kind of a few different ways. A lot of people use healthcare professionals when they have an injury. That's what prompts most people to make any sort of change in their life.
First decision.
Something happens. I have pain, I'm not well.
Yeah.
First decision. Who can I go and see? So I often see people initially when they're in pain. Fantastic. Okay. We work on getting them out of pain, getting them moving better. And then we kind of work on saying, okay, you're out of pain, you're moving better. Here are the tools that you can do at home on your own, or here, why don't you come in and we'll check on this every couple of weeks to make sure things are going really well.
Okay.
I talk about that sort of in terms of seeing your dentist. Some people wait until they need a tooth to be pulled before they ever go to the dentist. Other people say, hey, you know what? I can go once a year. I can afford to go if I have insurance or not. I'm going to have someone check on my teeth regularly. If I know that there's something that's a problem, we can address it earlier before it becomes, hey, we have to pull all your teeth, and there you go. So if we look at chiropractic, you can look at it the same way. I would like to have my spine assessed. Let's see, or the areas of my body that are moving. If there's some that need more help, fantastic. Let's work on those before they become a problem.
That's right.
It is always easier for you and for me as a doctor if we catch it sooner. It's cheaper for you if you catch it sooner. The longer you had something, the more work it is for both of us, the more time it takes, the more investment you have to put in my office and then outside the office to rehab something. So the sooner that you notice it, or sooner that a health professional catches it or finds it out, that's when we can have the easiest, most impact. And everyone uses it differently. I mean, I have patients that come regularly. Every so many weeks, they've been seeing me for years because it's just part of their health routine. They go to the dentist, they go to the gym, they do all these things on a regular basis that make them healthier. I have other people who use me only when they need me, and that might be once a year, it might be once every 5 or 6 years. We pull their file from storage every time they come in because it's been so long. And that's entirely fine too. I mean, I see that whole spectrum of people.
So they come in all folded over and
they do, and then we fix them up and send them on their way, and see you in 5 years, and that's the same pattern. And if that's what works for someone, I'll meet them where they are.
And obviously, we talked a bit earlier. You mentioned that it's more than just the spine. I know you talked about, but I know you have more qualifications and more things that you look after too, as part of a more holistic approach to this. What other aspects do you touch and you incorporate in this? Well,
one of the big things, I think also people expect chiropractic to be about the spine, about back pain or neck pain, and for adults only. And I would say that's part of the hugest thing that an extra part of learning that I've done is I've spent, I don't know, probably 250 hours now in additional training solely in pediatrics and pregnancy care. So looking at different populations. Why pediatrics? Lots of reasons that kids can be seen. Again, from the simple, let's check things before they become a problem, to, hey, you know what, my baby or my child isn't crawling correctly, isn't walking yet, cries all the time, is really uncomfortable. I mean, a baby can't really tell you a lot about what's going on. They can either cry more or less. Their sleep patterns can change. Their feeding habits can change. They can poop less. I mean, those are ways that they can tell you something's going on. And those are, techniques or like indicators that I use to help figure out what we can do for a baby. Chiropractic for children, chiropractic for babies is entirely different than it is for adults. Our techniques are different. Our approach is different. The goal is the same. It's to get things to move better, but it's an entirely different way.
It has to be.
It has to be. And then pregnancy care as well, the same thing. That's a period of time where the body undergoes like a huge amount of change. Huge. Right. Every day something is changing and is different. And so helping the mom through that. So with better movement, and maybe better labor outcomes, so maybe an easier delivery, or maybe an easier recovery after birth. But then also giving education to a new parent on how to carry a car seat, how to lift a baby, how to diaper a baby, different things that you can do that way that can also then have an impact not only on the mom or dad, but then also on the baby.
Yeah,
so it's like a full kind of circle.
Well, like the
thing.
diaper change you do many times a day, and if you're doing it wrong or pulling one leg or doing something,
there's a lot of tractioning and pulling, and the baby, it's just, if you can make it easier, fantastic. Carrying a car seat's a big one. If you can make that easier for someone, change your life. The car seat's heavy before your child's put into it. And the heavier your baby is, the heavier this car seat is. So.
And it's one way, because in the work I do, I often carry heavy things, and I always want two. So I can have one per hand, and
then make it easier. Yeah.
I don't care if it's twice the weight, or at least it's even. I can take it.
Yeah.
So I totally understand that, and I struggle more with the car seat than I do with my work. So
yes,
I
absolutely.
totally understand.
And also because the car seat carries a precious thing like a child. And if something at your job falls, okay, maybe it's not a huge deal.
I'll pick it up after.
Preferably not to drop your child.
I'll go back. I can cycle back. No big deal. Yeah. Perfect. All right. So I know there's a few myths going out there for that we want to debunk, first of all, for a few reasons, because I know for me it's been very beneficial to go see you.
Yeah.
For many reasons. I started to come see you about a month before I wanted to do my training program. I think that was a good decision.
I do too.
I rarely make good ones, but that was a good one. That was kind of stepping my ego aside, because I'm the kind of guy, I don't need to go see the doctor. I don't need to, I was born, and then 20 years later I went to the hospital for something.
Yeah.
That's
how it goes. Yeah.
I'm that type of guy. So by looking at what I want to do here, I kind of had to open my mind and kind of open my span up to get more information in there. So I came to see you about a month before I started working out. Now I'm working out, everything's going well. There's still some issues, of course, but we're working on those. But the beautiful thing is that I find is now I'm working on a permanent solution, because I'm tag teaming my working out with the other one.
Yeah.
Because I used to suffer through it.
Yeah.
Like my shoulder killed me, and I used to work it out just like I would until it was numb or I couldn't lift anymore.
And then you just stop it. Tomorrow you'd start again.
And then tomorrow I'll work biceps. It's all good.
Yeah, it's fine.
It'll have 4 or 5 days.
It'll be fine.
I'll do it again.
Yeah.
Yeah. So they got big and they got working, but still I can never sustain it.
Yeah.
I would reach a point that I'm starting to lift heavy weights. It's going well, and then
that's it.
Collapse.
And then for some people, they never get back to it.
Yeah.
You lift heavy weights. You have a shoulder injury. It always hurts. You just think, okay, then I'm just not going to do that anymore. I'm just not going to use that body part, which is not a great long-term solution to not be able to use your shoulder ever. It's and also because the shoulder is attached, to your elbow and your wrist. So then, what do you start doing to those areas if you can't use your shoulder?
Yeah, that's right.
What do you do to your upper back or your rib cage or your neck, because all the muscles are attached to that? So then it becomes like, well, it just was a shoulder injury, and now I have all these other things, and now I can't do normal things. I mean, I have people who come in who can't do their seatbelt up or can't put their arm in a jacket, and it's been like that forever. They just get used to it. That's
well, and on the other side, you compensate, like we said about lifting heavy things. If you can't do it with your left, you're always going to do it with your right. What does that do to your spine?
Absolutely.
So your power dominance becomes even more pronounced.
Yeah.
So that's all bad things. So anyways, that was a big tangent just to say that. Just to get back to these myths. The reason I want to debunk them is because for me, I saw the benefit right away. When I work out, I can see how it's working. I actually have a better feeling of how to move it, and I have the full range.
Exactly.
So that's kind of nice.
So you can move it, yeah.
I have 2 full ranges I've never had before. I have a full range of my shoulder, which I've never had before, and I actually have the full range of, I didn't know, but my lung cage, because I can actually breathe all the way in now. I didn't know I couldn't do that for a long time.
Yeah. That's actually one. Okay, so that's a thing I often do with people when they're like, how does posture affect or that kind of thing. I will tell people, bend forward, slouch forward a little bit. Take a deep breath in. It's really hard. Sit up better posture, better movement. So much easier to breathe. So that's something that you didn't know that you were doing, which meant you were probably always breathing shallow into your upper chest. All the time. That's not how the body's designed to function. So if you can breathe better, imagine. You're getting more oxygen in, you're getting more oxygen around your body. You can work out longer, faster, better, because now you can actually breathe. But aside from just working out, you can just breathe in regular life, which is also kind of important.
Breathe, oxygen, brain, everything works together.
A lot of things are really important. Yeah,
they get. It's kind of funny how we're all linked in.
That's right. So some of those myths. One of the myths: chiropractic's only for the spine.
Yeah.
We've already debunked.
Yeah, we've debunked.
I've worked on everything, and in fact, the reason there are some chiropractors who focus solely on the spine only. That's their bread and butter. That's where they really want to work.
It's a specialty.
It's a specialty. And if they say, you know what, you have some other type of injury, they refer out either to other chiropractors or to other therapists. Fantastic. My introduction to chiropractic was a knee injury. Okay. So already, that's why I look at the whole body in that tone. I was an elite level soccer player. I had a knee injury. I wanted to get back to playing, yesterday. I wanted to be right back into it. And I knew at the time, in order to see a physio, I needed to see a medical doctor first. And I'm lucky that back home, when I was growing up, I had a medical doctor, but lots of people didn't. There's a real shortage of doctors when I was younger. And so I knew, okay, I'll see my MD, they'll refer me to a physio, that's going to take me so long, or a sports med doc, well, that's going to take even longer. Well, I really want to play now. Like, how can I get back to it now? And I happened to have a teammate who was seeing a chiropractor, I don't even know what for, and her parents suggested, maybe Lindsay should go and see this person. Off I went, fixed up my knee injury, assessed it, diagnosed it, managed it, off I went, back to playing soccer quite quickly. And I thought, that is so cool. Yeah. Chiropractors are like sports med docs, but they don't go to med school, so I don't have to deal with blood. How fantastic. I'm going to totally be a chiropractor. 16 years old, I knew it. I wasn't until I was probably 20-ish, 20 or 21. I was in university, already decided chiropractic was my future. That's the first time I was ever adjusted, that I remember being adjusted. So I thought chiropractic was cool when all I thought we did was fix sports injuries. Okay. And I was amazed when I learned it had everything else to do with it, that it was the whole body, that was just one aspect that I'd seen. So that's how I approach my care in general, is like look at the entire body as a whole. And then figure out what can I do to help the whole body, and where I'm limited, I refer out to other practitioners. But a knee injury is what started me, so I'm fascinated with knee injuries and ankle injuries. I've had my fair share. Again, elite level soccer player, you get your fair share of injuries. I've had those. I've rehabbed them myself, but I've also helped people through a lot of other stuff as well. So that's a myth, not just for the spine.
And the other, you just mentioned as you were talking through it, you went to school.
I did.
Obviously.
For a long time.
So what does it take to be a chiropractor?
I have a funny story. When I was early on in practice, a couple of years in, I had a patient who said, she made a comment about how I looked so young, and which I thought was great, and I, of course, took the compliment.
Keep taking
and then
she said,
I think you and my daughter are about the same age. And I said, I don't think we are. And her daughter was in her early 20s. Okay. And I said, oh, no, I think I was in my late 20s at the time. And she said, well, I mean, isn't chiropractic just like you go to high school and then you go to chiropractic school and you become a chiropractor in a year or two? Yeah. And I said, number one, no. I mean, I wish that would have made it much faster. But no, this is an entirely different thing. So she trusted me implicitly with her care, fully, wholeheartedly, thinking that I had a year or two of training, which is fine. Yeah. I actually have a 4-year undergraduate degree in human kinetics and science. So human kinetics, study of human movement. Yeah. Mine was a science degree with a focus on kinesiology. Amazing. I have, the basics of anatomy and chemistry and biology and all that good stuff. Okay. You have to have at least 3 years of an undergraduate degree before you can apply to chiropractic college. I happened to do a full 4-year degree because I wanted to have that under my belt. Might as well. And it was so much learning, and I had some really amazing courses I took at university. I went to McMaster. It has a phenomenal kinesiology program. That was great. That was a really good, set me up well for my next phase, which is chiropractic college, which is a 4-year program. Again, it's a 3-year full-time undergraduate program with a 1-year internship. Okay. So 4 years, something like 4,200 hours of schooling after university. So mine was an 8-year jaunt. So you have to be pretty sure you want to be a chiropractor to do 8 years of training to become a chiropractor. So that's a thing. Yes, we have really similar education to medical doctors as well. Yeah. That's where a lot of people think you must be so different. We aren't. Our first couple of years, we're learning the same thing. We're learning, pathology and histology. We're learning about cells. We're learning anatomy. We're learning biology and chemistry, biochemistry. We're learning all of that stuff, the foundation knowledge about how the body works. Yeah. We diverge in terms of we take and learn how to take x-rays. We learn how to read x-rays far more than your medical doctor does. We do less pharmacology. They do obviously far more pharmacology. They're prescribing medications. We do more sort of physical diagnosis of the muscular system, so muscles and joints. Orthopedic testing in terms of those, we do far more than they do. Okay. But they do a lot more other stuff that I don't see, which is why they see different, you see them for different issues than you see me for. And then our 4th year is an internship, which is 12-month clinical internship working on real patients in clinical setting and learning how to do everything, but working specifically on patients. Okay. So
So I always found it amazing, even like when you find what's going on down there, and then I try, and I'm like, what's she looking for? I don't know what she's feeling over there.
Yeah, people are always surprised. And I would say, I mean, I've been in practice 11 years. So
Yeah.
I've had 8 years of training, 11 years hands-on. My hands are really smart. I often say like they know what's going on before my brain does. They can
Yeah.
just feel it. I just have developed that sort of sense of touch.
Yeah.
That takes a long time.
Yeah, it would.
Yeah.
It would.
Yeah.
Yeah, I could kind of relate it to like a mechanic that looks at a bolt and goes, go get the half inch.
Yeah.
You know.
They just know, or
Yeah,
know
you
how
just
much
look at it,
force
you
you're going to
feel it.
need for
Yeah,
something by doing it for a while.
Yeah.
Yeah, exactly. Same thing.
Yeah, it goes on. All right. The other thing is the evidence of support. They were
Right.
saying that there's not enough evidence in the study or in every, to I guess, I don't know
Yeah.
what evidence.
And more and more all the time, there's research coming out, especially for neck pain and low back pain. Phenomenal. There's tons of research in that because that's a really common thing that people present with. So we can present more and more evidence. There's newer evidence talking about how, obviously, one thing, back in the day, people used to prescribe bed rest. Oh, you have a bad back. Oh, you should lay down. Now we know that's pretty much the worst thing we could ever prescribe to someone, but that was general common knowledge by medical doctors.
Okay.
Lay down, you have a bad back, you should rest that thing. Okay, so we know that that's not true. Now there even more research about adjustments, about exercise, and about rehab, and how those are proving to be better outcomes than surgical outcomes for lots of cases. Not every case. Obviously, there's some that need surgery. But if we can do a conservative approach, so a non-surgery and professionally
non-invasive,
and probably that's definitely less invasive, and maybe a non-pharmacological, so less medication as well. There's lots of research showing about how hands-on treatment with movement, exercise, and adjustments, how that's really helping.
Yeah.
More and more research on that all the time is coming through. So that's kind of an old thing where people used to think, oh, you just saw the chiropractor, they just laid you on the table, they snap, and off you went.
Yeah.
And there's a whole lot more to that. This profession wouldn't be around if there wasn't more.
Oh, that's right. And the evolution of medication, or the medicine field, as you just mentioned, from in back, I don't remember what show I was watching, but the guy would heat up his knives before operating. He's like, it's a gift from God. I see less. There's less problems afterwards. Well, you just sanitized it. Yeah. And it's stuff
and
like
it's
that.
kind of that as well. And I would say also it's interesting, we won't delve into this too much, but there is, in medicine, if you look at a lot of the protocols that are used, a lot of that it's the same. It's like trial and error.
Absolutely.
And there's things that are prescribed now that don't actually work.
Yeah.
Put ice on swelling doesn't actually help reduce swelling. In fact, it probably makes swelling stay around longer. Or, you have a sprained ankle, you should be taking Advil. You should take an anti-inflammatory to stop the inflammation. Okay, sure, you stop the inflammation, you also stop the healing process.
Yeah.
And the healing process, healing goes from A to Z. If you cut the path off all the time at M because it helps with pain, fantastic, except if you don't get to Z, the tissue doesn't fully heal.
Well,
so that's something that's
there for a
changed.
reason. The body.
Exactly. It's more blood flow coming in to help support the area and get it out. We can manage how much swelling there is, but we need there to be some. We need there to be some inflammation. We need there to be some healing process.
That's right.
But there's lots of things that are sort of like, we try in medicine, you try this or try that. Oh, surprise, that medication helps with all these things, but doesn't really help with this. Okay, scratch that from this, and on it goes.
Yeah.
Medicine's constantly evolving in terms of that, and so are we in terms of the research and
you have to evolve because our society's evolving.
Yeah.
We're talking 70% obesity rate. I'm one of them. Trying to get down. But so you have this going on. You have all the sugar crazes coming on, and all the malnutrition going on. Even the fruits and veggies aren't what they used to be.
Yeah.
And we're going to see more of this.
A lot of stuff is changing.
Yeah.
And I think people are just more informed,
Mm-hmm.
sometimes for the better, sometimes for the worst, because most people Google everything, and Google is great, except Google will tell you whatever you're looking for. You type in the right term, it's going to tell you something.
It'll tell you what you want to look for,
Also, if you type in any of your symptoms, I can almost guarantee you it'll tell you have cancer. Because people type in certain words, and then Google picks up on keywords, and those keywords lead you to cancer. And I talk a lot of people off the ledge that I don't think it's that. It's more likely not that. It's probably something more simple. But it always gives you the worst case scenario.
Of course.
So Google helps to inform, but it's also a way for people to connect on all levels about all these types of things and alternatives to care.
Yeah.
So if you think the only option when you're sick is your medical doctor, then that's all you know. And if that's all you've ever known, it's all you'll ever know.
Mm-hmm.
If you start to say, that's great, but my MD isn't a specialty in this. Or, in my case, I have some really great medical doctors that refer patients to me. Sometimes it's the patients that they just don't know what to do with.
Yeah.
But sometimes it's like, you know what? oh, I know a chiropractor. She works on these types of things. Go and see her. The medical doctor's kind of limited in what they can give you.
Yeah.
Medication?
Yeah.
Referral to a specialist.
That's right.
If they don't think it's one of those two things, if they don't think it's medication, or they don't think it's the typical physio referral thing, say, let's try something different. You've tried these other avenues.
Mm-hmm.
What's the harm in trying something new? Fantastic. That's been a great referral source for me.
Yeah, for sure. Well, doctors are, I think the medical field has started to actually work together.
Well, I think they've also realized that no one profession can fix everything.
Absolutely.
So if we all work together, we all do better as professionals because our patients get better.
Yeah.
And that's the number one thing. I mean, we like to be successful. If I don't think I can help you, I'm not just going to keep seeing you again and again. I don't feel very successful. So no matter what profession it is, they say, you know what, this is kind of out of my wheelhouse now. I'm going to refer you to someone else. When that works, you look successful.
Yeah,
fantastic.
right.
Everyone's happy. Everyone wins.
Yeah.
Patient wins because they feel better. That practitioner wins because they've seen a patient who gets better.
Made a good referral.
The first one wins because they made that good referral.
Yeah.
That's fantastic.
How important is the patient's part in this? Like my part.
Huge.
So like
I mean, chiropractic will probably help you,
mm-hmm.
no matter if you follow my advice or not. The treatment itself is probably going to help.
Yeah.
It will help more if when you leave, you do some of the homework I give you.
Yeah.
So if you keep doing the same thing you've always done, you're always going to get what you've always got. That's like a common saying people know.
Yeah.
You have to change something. So coming to see me, that's a change that will help. If we say, hey, I need you to do these 3 things at home, and typically my homework is very simple. It's usually move every 20 minutes.
Mm-hmm.
It's usually, hey, when you're sitting, don't cross your legs. And it's, use some heat or use this or a couple of other options. Really simple stuff. If you can follow those, you're going to start to feel better.
Yeah.
If we change that and I give you some stretches to do or some movement exercises to do and you do those, you'll probably feel even better. If we start talking about, hey, you need to drink more water because your muscles are dehydrating and that you're not healing well, or
mm-hmm.
hey, I think this supplement would help, or hey, maybe we should think about maybe not smoking because that's causing some inflammation, or maybe we should think about not eating fast food or processed food so much because that's causing some inflammation. If you can touch on even a little bit of any number of those things, suddenly you're going to get a whole lot better. If we can touch on then maybe how your workstation is set up at your job, or we can look at how you do your job. So if you have to bend a lot for your job every day and you have terrible mechanics, you don't bend properly, I mean, that's going to keep happening. So if we can just keep touching on broader and broader subjects all the time, you'll do better and better. But if you don't do any of that stuff, okay. And this is my thing I often say, fantastic. Come and see me as often as you want to. I will happily take your money.
Yeah.
I will happily see you in my office. Any professional would. We will be happier to see you when you're doing better, which means you've got to give a little bit here.
Yeah.
And if you don't want to, okay, but your results probably won't be as good as they could be.
Right. And that's where probably the myth of you have to keep coming back and
that's one of my favorite. That's always your choice.
Yeah.
Again, I think we talked a little bit earlier about you can come in because you have symptoms. You want to see me until your symptoms are gone. And you don't want to see me again. Amazing. But then I'd say keep doing what we've done to get you this far.
Don't just stop there.
Don't stop because it's probably going to come back.
Yeah.
People have come in and they said, I saw XYZ practitioner before. Didn't work. Okay. Did they give you some homework to do? Mm-hmm. Mm-hmm. Do you still do that homework? No. Okay. So here's the deal. If you don't keep doing the homework, it's probably going to come back to some extent.
Yeah.
Do you have to keep coming back after? No, it's entirely up to you. If it's helping you to feel better, if it's helping to keep you more accountable with the things you do outside, fantastic. Then I think maybe you should come in and see me more often.
Yeah, if it's
but if it's your choice to come back or come back regularly, either because you want to or because you feel it's what you can do.
Yeah.
I have some people who come super often. They probably like to come less. However, they fully recognize that their lifestyle is going to lead them in a certain path. And they're not willing to change, or they can't change enough of those things. So they think, okay, chiropractic's the thing that's going to help me get to the next stage. Okay.
Yeah. Yeah. Well, it's part of everybody has their own thing. We're looking for the whole holistic part of everything, but everyone's got their own thing. But if they can help a little bit, that's, what you can do, right?
Yeah.
Yeah, so once you start, you can't stop. That was one of the ones. You need a referral from a doctor. We touched on that.
Correct, you don't need that. I'm a primary entry-level physician, which means you can see me directly off.
Which is what I did.
Yeah, exactly. Now, some insurance companies maybe are requiring this now. Something we've heard about, but it should not be the requirement. You should be able to see any primary entry physician directly. You don't need a referral to see your doctor You don't need your referral to see your dentist or your eye doctor or psychologist. All of those are primary level physicians as well.
Okay.
So, yeah.
Okay, so I came to see you. I'm starting to work out. What do you suggest for me, somebody in my position? What's my next step?
Continue doing what you're doing.
Okay.
And then gradually, I mean, we talked about the shoulder, so you're going to see physio to kind of work a little bit more than I can do that for you.
Yeah.
Then you're going to do the homework the physio gives you.
Yeah. Yeah, because I did the was a chest exercise yesterday, but where you lay down on the bench and I had the weight above my head, going back like this and like this, and all sorts of noises came out of there. And I thought, I'm like, here we go. It's going to be numb for the rest of the day, and actually feels great.
Okay.
It's the first time I do that exercise, and the first time I hear that amount of noise coming out, or that I feel that amount of crunching coming out of it. Yeah. So I don't know if I broke something loose or if I'm working something, but
it might just be working the range of motion.
Yeah, it could be. But that I thought it was going to be done for the rest of the day, and it was the opposite.
Yeah,
it felt great.
Yeah. Part of my work, I would say, also is helping people to realize when something hurts versus it being harmful, because sometimes things are a bit uncomfortable, but we have to know when we should stop pushing through that, when it's like, this has gone beyond like, okay, this is a little uncomfortable, to like, this is painful.
Damaging.
That's the time to stop.
Yeah.
Is the like, oh, that doesn't feel so good. But also to tell people that you have to move and that their body is capable of movement. Because I think also sometimes when people get kind of chronic injuries, they often fear movement.
Okay.
Oh, I know when I bend forward, I'm going to do, so I just don't do that anymore. Okay, but if you stop doing it, how is it going to get any better?
You just have to do it more consciously.
We just have to be more aware of it and know, okay, there's a certain tolerance. You're not going to get an injury until your body, the load of whatever you're lifting or the mechanics of it exceeds the tolerance that your body has. You have a certain amount your body, your tissues are able to handle. If you push them past that, you'll probably get an injury. But we need to kind of learn where that range is. And so especially people with chronic or longer standing issues, it's harder for them to find that range. And so my job is to not only help them find the range, but increase the range of movement that's comfortable, but that it's safe to move. Because if you don't move at all, you won't be able to move. And then we never get anywhere.
Yeah, then it's all locked in and that's it.
Then that's it. And then how sad is that if you can't ever do any of those activities, if you can't ever bend forward because you're always fearful that it's going to injure you? Okay, that's pretty limiting for life. I mean, beyond just chiropractic, that's pretty limiting for putting your shoes or your socks on or lifting up your kids or your grandkids. I mean, those things are kind of important parts of life. Like, we don't want to miss out on those because we're a bit afraid that we've done something. So,
You talked a little bit about inflammation earlier. To help with inflammation and the prescriptions and stuff like that. Any foods that you know naturally that would probably help with inflammation that would still let you have the healing process that doesn't hinder it?
I mean, most foods in general, fruits and vegetables, pretty helpful in general.
Those always
things from the earth are probably more helpful. So that you can't, not that you can't go wrong with them, but for the most part, most people can tolerate those really well. Sugar is like a huge inflammation response. So anything that has sugar in it or is processed is probably something you want to decrease.
Eliminate, let's be honest, but a little bit
at least
time,
decrease.
Right?
Yeah, I mean, I think if we 100% cut out things totally, that's really hard to maintain long term. Easy to do in the short term, to say I'm not going to have that anymore ever, ever, ever. Okay, great. It's probably not realistic for life in the long term, but learning how to manage a little bit of something.
A little bit of change, a little bit of leeway. I talk a lot about little wins. Just one little win at a time.
Exactly.
So, coming to see you, one little win. I feel better psychologically because I'm being aware of what I'm doing, and then I'm on my next track. And then it's, if you eat junk food from morning to night, well, start by a little win. Let's eliminate the breakfast. Let's make a good breakfast, and then
go from there.
And then,
exactly. Because if you said to yourself, if you only ever ate junk all day long, if that's all you did, and you're like, I'm not going to eat junk ever again, and that's something that gives you some pleasure. If you get some pleasure from some aspect of eating that. Now, maybe 3 meals a day of junk is not great, but if you say, you know what, chocolate is really a thing I like, I enjoy. Great, let's find the healthiest way of eating that chocolate and eat it so that it's like a special thing you can enjoy. But if you cut that out entirely and you never allow yourself to have chocolate again, all you're asking for is to get in a situation where things are a bit hard, and then you're just going to crack.
And you're not just going to crack and have a piece.
No, you're going to go full tilt. You'll slide right back.
So
if it's saying, you know what, every so often I need to have a piece of chocolate because a little piece of dark chocolate makes me feel good, fantastic. Go bananas. Let's switch it to dark chocolate. Let's try that, once a day instead of 3 meals a day of that.
Schedule it in, make it into your reward
Yeah.
for something. You know, all these little things you can psychologically do to
get
gear
there.
yourself a different way.
But telling yourself that I can't have all these things, I can't, that's really,
I can't
that's a
ever
great
anymore.
way to just end up not only back to where you were, but probably worse off
that's
for
right.
most people.
Well, you always bounce back, but there's, you know, because I've had the peaks and the valleys quite a bit.
Yeah.
And that's why I started this program, because I was tired of the valleys. I want
Yeah.
to see my peak, and I don't want I
Just
want
want
to
to
keep going.
and maintain that. And
That's
I
right.
mean, normally in life, we're going to have a couple of that
Of course.
up and down. It's going to happen. We also want it to be like the swing of
Yeah.
very, very high to very, very low, because it's
Yeah.
very hard. It gets harder and harder to come out of that lower aspect.
And I assume with, I'm working on it again, I'm going to be, you know,
Yeah.
I have different goals now in mind, so it's
Yeah.
going to be, it's actually really interesting and fun. But I assume I've had, I would say 3 swings of 80 pounds or so, 80 to 100 pounds or so. That can't be healthy either.
It's probably not, no. But I would say being down that weight or being some consistent that you can keep, that's far more healthy than the swinging.
Well, yeah, I don't want to swing.
No,
That's too much of a swing.
Yeah,
but
that's a huge
But
swing.
I'm just saying, like, the only thing, I'm a guy that always finds positive. The
Yeah.
only positive I can find from it is I have a lot of good leg training.
Yeah.
Because I've had
Because
years,
you carry yourself around.
years of having to carry myself around, and then losing the weight feels great.
Well, most people skip leg day anyway, so there you go. You've already started.
Never skip leg day. Every day's leg day.
Every day is leg day.
Yeah, that was always, well, there's always a good part, right? Oh, well, yeah, so, only see when you hurt. So I guess we went through a lot of details here today with parts of chiropractic and how it fits into a holistic kind of view on everything.
Yeah.
And I hope we debunked a few myths for people out
Hopefully.
there.
Yeah. And I would say, in general, I mean, I recommend people come and meet a chiropractor.
Yeah.
Meet with us. If we're not the right fit for you, I'm not the right doctor for everyone. I fully recognize that. It's finding the right fit in terms of, you know, the office location, but also the person that you're seeing. If you're not comfortable with them, it's never going to work.
Yeah.
If you go in believing something's not going to work, guess what? It's never going to.
That's right.
So if you go in thinking, you know what, I'm going to be a little bit open-minded to this and to see what they say.
Yeah.
If it resonates with you, fantastic. Continue on. If that's not something where like, this doesn't sound right to me, this style of practice, or this isn't the thing, great. Either say that to the practitioner, or try another person, or ask some friends and families, people that you think you're similar with, to ask them who they would fit the best with. Or not, I mean, it's not a one size fits all. It's really finding the right approach, the right person for you.
That's right.
That helps me. The more comfortable you are with me, and the more honest you can be with me, obviously the easier my job is, and the better the care I can provide for you.
Well, it is, because you know, the more it makes sense. Everything that you see, you can deal with. Like, we talk about inflammation and stuff like that. Well, if you eat McDonald's 3 times a day, I don't know if I can say that, but anyway, if you do that 3 times a day and then go see you and like, well, my back is kind of,
yeah. Or when I sit 8 hours a day at my computer after I've driven to work. I sit on my break. I sit on my lunch break.
Yeah.
I sit in the car on the way home. I come home. I sit all night. Okay, at some point, like, something's got to give. And if we can change any little aspect of it, great. Also, I mean, chiropractic is hands-on care. I use my hands to adjust and to assess and to manage people. So you have to be comfortable with your practitioner, because they're going to have their hands on you.
Yeah.
That's how it works. I mean, for the most part, there are some hands-off techniques that people do. I'm entirely hands-on. I have all different stuff that I do, but it's all about feeling and touching and making things work better.
That's how you figure it out.
That's how I figured it out.
Yeah.
These are smarter than I am, these hands.
Sounds good. On that note, it was nice seeing you.
Yeah, you too.
And hope you come back again. We'll tear into some more myths and work some more things out.
Sounds good.
Sounds good. We'll meet on to the next step, and I actually will see you this afternoon.
Ah, fantastic.
As soon as I can get this to open up and stop. I can edit this part out, so it doesn't really matter. All right.